हेलो स्टूडेंट्स, वेलकम बैक टू नॉलेज डॉट इन। तो लास्ट क्लास रे हमें एसएसबी टीटी एलटीआर लगी किछिटा एमसीक्यू देखितिला सर्कुलेशन चैप्टर रो। एबे आउ किछिटा सेही सर्कुलेशन चैप्टर रो एमसीक्यू देखमा। ओके, तो चलो देखमा। तो क्वेश्चन नंबर 81, व्हाट इज द टर्म यूज्ड टू डिस्क्राइब द मिक्सिंग ऑफ ऑक्सीजनेटेड एंड डीऑक्सीजनेटेड ब्लड इन द हार्ट ऑफ एम्फीबियंस एंड रेप्टाइल्स? एम्फीबियंस और रेप्टाइल्स रो मिक्सिंग हो जे ऑक्सीजनेटेड एंड डीऑक्सीजनेटेड ब्लड सेटा के हमें काना कहमा। तो ऑप्शन सी इनकम्प्लीट डबल सर्कुलेशन, ऑप्शन सी इज द राइट आंसर। क्वेश्चन नंबर 82, हाउ मेनी सर्कुलेटरी पाथवेज आर प्रेजेंट इन बर्ड्स एंड मैमल्स? केतरा रहउचे 2, ऑप्शन बी इज द राइट आंसर। क्वेश्चन नंबर 83, व्हाट इज द फंक्शन ऑफ द लेफ्ट एट्रियम इन बर्ड्स एंड मैमल्स? लेफ्ट एट्रियम रो फंक्शन काना? रिसीव्स ऑक्सीजनेटेड ब्लड, ऑप्शन ए इज द राइट आंसर। Question number 84. What is the term used to describe the circulatory system with two separate pathways for oxygenated and deoxygenated blood? तो ताकि हमें कहना कहमा डबल सर्कुलेशन, सेपरेट पाथवे है डबल सर्कुलेशन, ऑप्शन बी इज द राइट आंसर। व्हाट इज द मेन फंक्शन ऑफ हार्ट इन सर्कुलेटरी सिस्टम? मेन फंक्शन कहना पंप ब्लड थ्रू द बॉडी, ऑप्शन ए इज द राइट आंसर। क्वेश्चन नंबर 86, व्हाट इज द मेन ऑर्गन ऑफ द ह्यूमन सर्कुलेटरी सिस्टम? ह्यूमन सर्कुलेटरी सिस्टम रो मेन ऑर्गन कहना हार्ट, ऑप्शन सी इज द राइट आंसर। क्वेश्चन नंबर 87, हाउ मेनी चेंबर्स डज द ह्यूमन हार्ट हैव? ह्यूमन हार्ट रे कितना चेंबर होची? 4टा, ऑप्शन डी इज द राइट आंसर। व्हाट इज द साइज ऑफ द ह्यूमन हार्ट कंपेयर टू? ह्यूमन हार्ट केंदे करी कंपेयर करा जाय छै? एक क्लेंच्ड फिस्ट, ऑप्शन ए इज द राइट आंसर। व्हिच मेम्ब्रेन प्रोटेक्ट्स द ह्यूमन हार्ट? ह्यूमन हार्ट के किए प्रोटेक्ट करछि? पेरिकार्डियम, ऑप्शन ए इज द राइट आंसर। क्वेश्चन नंबर 90, व्हाट सेपरेट्स द अपर चेंबर्स ऑफ द ह्यूमन हार्ट? अपर चेंबर के एट्रिया के किए सेपरेट करू छै? इंटरएट्रियल सेप्टम, ऑप्शन ए इज द राइट आंसर। क्वेश्चन नंबर 90A। क्वेश्चन नंबर 91, व्हाट सेपरेट्स द लोअर चेंबर वेंट्रिकल्स ऑफ द ह्यूमन हार्ट? वेंट्रिकल के किए सेपरेट कुछ? इंटरवेंट्रिकुलर सेप्टम, ऑप्शन ए इज द राइट आंसर। क्वेश्चन नंबर 92, व्हाट इज द वाल्व दैट गार्ड्स द ओपनिंग बिटवीन द राइट एट्रियम एंड द राइट वेंट्रिकल? राइट एट्रियम और राइट वेंट्रिकल रे केन वाल्व रहउची? ट्राइकस्पिड वाल्व। क्वेश्चन नंबर 92 आंसर ऑप्शन ए इज द राइट आंसर। क्वेश्चन नंबर 93, what is the valve that guards the opening between left atrium and left ventricle? Left atrium और left ventricle भितर केन valve रहउची? mitral valve, option A is the right answer. Question number 94, what are the openings of the right and left ventricles into the pulmonary artery and the aorta respectively provided with? So either and what are the openings of the right and left ventricles into the pulmonary artery and the aorta? The answer was semilunar valves, option A is the right answer. Question number 95, what is the primary function of the valves in the human heart? Primary function का to allow the flow of blood only in one direction, option A is the right answer. Question number 96, what type of muscle make up the entire heart? Entire heart रे किन प्रकार muscle रहउची? Cardiac muscle, option A is the right answer. Next question number 97, what specialized cardiac musculature is distributed in the heart? केंता प्रकार रहउची cardiac musculature distribute करी? Nodal tissue, option A is the right answer. What is the pacemaker of the human heart? Pacemaker काहे कहउछु? SA node, sinoatrial node, option A is the right answer. Question number 99, what are the two upper chambers of the human heart called? Human heart are two upper chamber के काना कहउछु? Atria, option A is the right answer. Question number 100, what are the two lower chambers of the human heart called? Ventricles, option A is the right answer. What is the purpose of the pericardium surrounding the human heart? Pericardium के surrounding करी? Pericardium काहे surrounding करी? Purpose protection लगी, option A is the right answer. What is the role of the sinoatrial node in the human heart? SAN रो काम काना? Initiating and maintaining rhythmic contraction, option A is the right answer. What is the average heart rate of a human being? Average heart rate केते? 72 रहउचे, तो आमे जदि ऑप्शन देथि बनता 70 to 75 beats per minute करि परबा। Question number 104, during which phase of the cardiac cycle are all four chambers of the heart in a relaxed state? Joint diastole, option A is the right answer. Next question number 105, what is the main function of the tricuspid and bicuspid valve during the cardiac cycle? Prevent backflow of blood into the atria, option A is the right answer. What causes the closure of the tricuspid and bicuspid valve during the cardiac cycle? Increased ventricular pressure. Option A is the right answer. What event marks the beginning of the atrial systole during the cardiac cycle? तो आंसर काना हवा generation of an action potential by SAN. Option A is the right answer. What is the primary function of the atrial systole during the cardiac cycle? Question number 108. Increase the flow of blood into the ventricles. Option A is the right answer. Question number 109. What conducts the action potential from the atria to the ventricles during the cardiac cycle? AV bundle. Option A is the right answer. What causes the opening of the semilunar valve during the cardiac cycle? Increased ventricular pressure. Option A is the right answer. Question number 111. What prevents the backflow of blood into ventricles during the cardiac cycle? Closure of the semilunar valve. Option A is the right answer. What causes the closure of the semilunar valves during the cardiac cycle? Okay. Decreased ventricular pressure. Option A is the right answer. Question number 113. What is the average duration of cardiac cycle? Average duration कितनी? 0.8 second. What is the volume of blood pumped out by each ventricle per minute during the cardiac cycle? देखिए हमें कहना कहूँ stroke volume. Option B. How is the cardiac output calculated? Cardiac output केंद्र calculate करूँगा. Stroke volume multiplied by heart rate. Option A. What is the primary factor determining the cardiac output of an individual? Question number 116. देखिए कहना कहूँगा stroke volume. 117. What are the two prominent sounds produced during each cardiac cycle? Love and dove. Option A is the right answer. Question number 118. What is the first heart sound love associated with during the cardiac cycle? तो कौन है এটা? Closure of the tricuspid and bicuspid valve. पहला sound होचे closure of tricuspid and bicuspid valve. Question number 119. What is the second heart sound dove associated with during the cardiac cycle? Closure of the semilunar valve. Option A is the right answer. What are the three layers that compose each artery and vein? Tunica intima, tunica media, tunica externa. Option A is the right answer. Where does deoxygenated blood enter after being pumped by the right ventricle? Right ventricle to pump करी केन के जाउची? Pulmonary artery. Option A is the right answer. What is the pathway through which deoxygenated blood is carried to the lungs and oxygenated blood is returned to the left atrium called? एक काना कहमा pulmonary circulation. Option A. What is the name of the vascular connection between the digestive tract and the liver? Hepatic portal system. Option A is the right answer. Which signals increase the rate of heartbeat and the strength of ventricular contraction, thereby increasing the cardiac output? Sympathetic neural signals. Option A is the right answer. Question number 125. Which signals decrease the rate of heartbeat and the speed of conduction of action potential, thereby decreasing the cardiac output? Parasympathetic neural signal. Option A. What is the term for the specialized muscle responsible for the intrinsic regulation of the heart, hence making the heart myogenic? Okay, term है nodal tissue. Answer option A is the right answer. Which system of blood vessel is exclusively dedicated to the circulation of blood to and from the cardiac musculature? Coronary system. Option A is the right answer. Question number 128. What is the function of the hepatic portal vein? Carries blood from the intestine to the liver. Option A is the right answer. Question number 129. What is the term for the pathway through which oxygenated blood is carried by arteries, arterioles, and capillaries to the tissue? Systemic circulation. Option A is the right answer. Question number 130. Which hormone can increase the cardiac output? Adrenal medullary hormone. Option A is the right answer. What is the primary function of the coronary system of blood vessels? Circulation of blood to and from the cardiac musculature. Option A is the right answer. Question number 132. What term describes the electrical excitation of the atria in the ECG? P wave. Option A is the right answer. What term describes the electrical excitation of the ventricles in an ECG? QRS complex. Option A. What term describes the repolarization of the ventricle in an ECG? P wave. Option A. Question number 134. Option A is the right answer. Question number 135. What specific event marks the beginning of the systole in the heart during an ECG? The start of ventricular contraction. Option A is the right answer. Question number 136. What specific events marks the end of systole in the heart during an ECG? The end of T wave. Option A is the right answer. Question number 137. Which sounds are associated with the closure of tricuspid and bicuspid valve respectively during cardiac cycle? Locked up. Option A is the right answer. What is the term for blood pressure higher than normal, typically measured at 140 by 90 mmHg or higher? Hypertension. Option A is the right answer. Question number 139. In a blood pressure measurement of 120 to 120 by 80, what do the numbers 120 and 80 represents? Systolic and diastolic. Option A is the right answer. Question number 140. What is the term for the pressure during heart contraction, represented by the higher number in blood pressure in a blood pressure reading? Option A, systolic, is the right answer. Question number 141. Which organs can be affected by hypertension? Heart, brain, and kidney. Option A is the right answer. 142 question. What is another term for coronary artery disease? Coronary artery disease के मैं कौन कहूँ? Atherosclerosis. CAT or atherosclerosis. Option A is the right answer. Question number 143. What causes coronary artery disease? Deposits of calcium, fat, cholesterol, and fibrous tissue narrowing the artery. Option A is the right answer. Question number 144. What symptom is associated with angina? Acute chest pain. Option A is the right answer. When does angina typically occur? When there is not enough oxygen reaching the heart muscle. Option A is the right answer. Question number 146. What is the condition called when the heart is not pumping blood effectively enough to meet the body's need? Heart failure. Option A is the right answer. What is the another term for heart failure often used because congestion of the lungs is a symptom? Congestive heart failure. Option A is the right answer. Question number 148. Each heart failure the same as cardiac arrest or heart attack? No. Option A is the right answer. What is the primary symptom of angina? Chest pain. Option A is the right answer. Which symptom is associated with heart failure? Congestion of the lungs. Option A is the right answer. Question number 151. What condition occurs when there is not enough oxygen reaching the heart muscle, causing acute chest pain? Angina pectoris. Option A is the right answer. Question number 152. What condition is characterized by deposit of calcium, fat, cholesterol, and fibrous tissue narrowing the artery? Atherosclerosis. Option A is the right answer. Question number 153. Which term describes the pressure during heart relaxation represented by the lower number in a blood pressure reading? Diastolic. Option A is the right answer. Question number 154. Which condition affects the vessel supplying blood to the heart muscle? Coronary artery disease. Option A is the right answer. Which term describes the electrical activity of the heart during a cardiac cycle represented by peaks in an ECG? Electrocardiogram. Option A is the right answer. Which vessels are affected by atherosclerosis in coronary artery disease? Vessels supplying blood to the heart muscle. Option A is the right answer. तो इला थिला हमर लास्ट क्वेश्चन तो एने करी हमें टोटल सर्कुलेशन रो 156 टा क्वेश्चन देखला तो जहार केनसे नबी किछि डाउट हबा कमेंट सेक्शन रे कमेंट करके बताओ ओके प्लीज लाइक शेयर एंड सब्सक्राइब थैंक यू